Without further ado, the first recipient of the award is receiving the award for demonstrating a solution that enables patient control of their information. This solution provides patients the ability to make privacy choices consistent with ONC's model privacy notice. More importantly, what we found is this solution not only has a way and a mechanism to capture patient preferences and patient consents, but it has a way to translate those patient consents to the technology in the background. And so this solution actually results in configuration changes and technology changes around how data is shared and distributed, not only within the healthcare provider environment, but beyond the walls of the healthcare provider environment with things like the National Health Information Network, or HIEs. So without any further ado, I'd like to welcome up David Staggs from Jericho Systems. Please give him a great round of applause.
Thank you very much. I'm very happy to accept this on behalf of Jericho Systems. We've been involved in healthcare for many years, about 7, working with standards committees. So the idea is that the use of electronic records is being incentivized by several governments out there. The United States is trying to incentivize use of EHRs. Already it's grown to about a third of all physicians having a basic EHR that allows you can see over time that it's gone up. It's a third right now. So the idea is that now that you have all these EHRs, now have all this information that's being populated about the patients, what's going to happen when it's being shared? And how are you going to control that? And the principles I've been hearing all today, through today, is it resonates with our opinion, our attempt at having individual control, having transparency, and having the ability to have accountability. So I think you'll be pleased about what we're doing, and we'd really like to get your input about what you think of what we're doing. So here I go through. These slides will be available. I don't need to read them, but I do want to remind everyone about what's going on with the administration and how the White House, how our president, and how Office of National Coordinator is trying to lead this, how patients should be able to exercise meaningful consent to their participation. And that's something else that's been going through the conversations today. So patients should be able to easily express their privacy consent directives. So what's going on with ONC? What are they doing to give us that? They're coming out with these PHR privacy model notice, the model privacy notice. So they're describing it's not required, but they're saying how you should be able to reach out to patients and allow them to choose whether their personal data is used or whether their statistical data is used. So you're starting to see this type of involvement that I think it's reflected in across the industry. The George Washington University policy considerations paper talks about the core consent options. So we're focusing on that as well. So what we want to do is allow patients to have a meaningful ability through a PHR to describe how they want their information used. So I have a bit of a description here. Here is what was described as the Nationwide Health and the NHIN, the Nationwide Health Information Network. So that's where the big providers are exchanging the information. And what you can see is it's very simple to allow a patient to see who's making requests on their information. So in this case, there is a request by a person at a particular place, like some government hospital, and the purpose of use here is marketing. And don't get nervous. I don't know of anyone actually using marketing on the NHIN, but what it is it's a purpose of use. So ISO and also ASTM and HL7, those are all groups that are using the same kind of purpose of use. So you can tell if you have a normal healthcare request, what sort of policy to apply to it. If it's an emergency, it might be a different type of policy you want to apply to it. But in this case, we're allowing the patients to make their own privacy policies. So in addition to the organizational and jurisdictional policies, we're adding on the patient's ability to do it. So here they've seen that there's a marketing request, and they may decide they don't want to allow their information to be drawn through the NHIN for marketing. So we give them the ability to specify their purpose of use. They can unclick marketing, And you'll see the next time there's a request across the NHIN, which we've done through simulations, you can see that now it's denied. But the request later on for emergency request, that's been permitted. So here's you have the granularity, and we're not saying we've solved anything. We're saying that the technology exists so that people can use a PHR and actually have an effect on the overall system.